Before I share numbers for the past 24 hours, I want to talk about shame. This is a common theme I have been hearing over the past few weeks, reported by our contact tracers, who are talking with people who test positive and their contacts. This worries me. Shame is an emotion that drives people to hide or to cover up what they are ashamed of. It can be triggered by anger and judgment from others, or by an individual's own beliefs about what has happened. The more that COVID drives shame, the harder it will be to prevent, as people will be less willing to be forthcoming about their symptoms, less willing to be tested, and less willing to be honest with contact tracers about their activities. We need to fight shame with compassion. Let's be honest, living with COVID-19 is really hard. We are all tired. It is easy to be frustrated or even angry if our lives are disrupted further by an exposure to COVID from someone in our circle. And yet many of the cases and outbreaks we are investigating have been triggered by a series of unfortunate events. I confess that I sometimes forget to sanitize my hands after opening a door and touching the door handle. None of us is perfect. We all make mistakes. We are all trying the best we can to follow the rules as much as possible. But one slip at the wrong time and place can lead to transmission. We must be compassionate with those who test positive. We must support those who have even mild symptoms to stay home and away from others without shame. Our success depends on this. Turning to today's numbers, we identified 103 new cases in the last 24 hours. There are now 1,084 active cases in the province. Currently, 43 people are in hospital, including 12 in intensive care. Tragically, I am reporting one additional death today. It is tempting to become numbed to these numbers after a while, yet each number represents a person who is left behind grieving family and friends. I offer my condolences to all who are grieving losses of any kind right now. I know that many parents, teachers, and students still have questions and worries about Alberta's school re-entry plan. Many of these questions are around what evidence informed the public health recommendations we provided to the school return plan. My advice is based on a review of evidence on what has worked or not worked around the world, and on what science and medicine have learned about children and their experiences with the COVID-19 virus. Some may wonder why we would reopen schools at all during a pandemic. My answer is that we must look at the overall health of our population and everything that contributes to health. We cannot simply focus on COVID-19 alone, as there are other risks that must be factored in. We know a great deal more about the virus now than we knew 6 months ago when we were dealing with our first cases. We also know very clearly that measures taken to prevent the spread of COVID came with their own risks to health and wellness. We must learn how to live with this virus and how to find the right balance between preventing uncontrolled COVID spread and preventing the harms that come from shutting down essential parts of our society.